Hello, nice to have you in this another not so popular part of orthodontics nowadays. Since everyone, and I mean everyone, doctors and patients are interested in more advanced, full fixed ortho and or very digital things, in this series of short webinars I would like to try to drag your interest and focus on things which are interesting enough and important to stay as an important part of the patient care. It helps us to convert the patient into light or no cases, and these are procedures which are used long time before fixed and aligner treatments, which are nowadays orthodontists and patient hype. So before we start, I would like to introduce myself, but briefly and very shortly. So if you already seen the removable webinar series, then you can simply skip this part. I was born on 1969 and I graduated 1998. I finished my ortho residency in 2008. During the ortho residency, I was highly interested in biomechanics, TADS, corticotomies, regional accelerated phenomenon, and growth. The recent highlights are GET system and myofunctional therapy. My professional activities, well, I started private practice from 1998 and I am still having it. Also, I initiated a static functional orthodontic group. I also initiated Croatian Orthodontic Society and I was president and now I am vice president. Recently, a year, I work in a public clinic and I'm still working in it today. I lecture locally and internationally, and I ran an ortho study club. Privately, I travel, tango, and I do a lot of other things. But let us start with the topic. Orthodontic in general deals with the three types of procedures: the preventive, interceptive, and the treatment procedures. Preventive ones are undertaken in anticipation of a problem in development, whereas interceptive ones are taken when the problem has already manifested. Ortho treatment itself comes to play when we have to correct already expressed anomaly when none of the first two procedures are suitable. Let's run through some of procedures undertaken in preventive orthodontics. Parent and patient education, caries control, care of deciduous dentition, management of ankylosed teeth, maintenance of a quadrant-wise tooth sheathing timetable, checkup of oral habits and habit-breaking appliance if necessary, occlusal equilibrium if there are any occlusal prematurity, supernumerary teeth extraction, space maintenance, deeply locked first permanent molar management, and abnormal frenal attachment management. So the interceptive procedures or appliance can be divided in the mobile, fixed, and combined. I would like to introduce you shortly what are we going to take care during this series of 4 topics of interceptive treatment with a fixed appliance webinar. So first we're gonna do a space maintainers. Later we will do habit breakers. Then we will look through space gainers and then just a little bit on carrier motion. Let's start with the space maintainers. When do we need space maintainer? In the premature loss of deciduous teeth, we can see drifting of adjacent teeth into the opened space. So medical definition of a space maintainer is a temporary orthodontic appliance used following the loss or extraction of a tooth as a milk tooth to prevent the shifting of adjacent teeth into the resulting space. Ideal prerequisites of space maintainer: should maintain the entire mesiodistal space created by tooth loss. They must restore the function as far as possible. Prevent eruption of opposing teeth. It has to be simple in construction, strong enough to withstand the functional forces, not exert excessive stress on teeth, permit maintenance of oral hygiene, and permits normal growth, development, and natural adjustment which takes place during the dentition transition. I will show you some pictures. For example, these are single tooth space maintainer on the both sides. Also, we can use a lingual arch, or in the upper we can use a Nance arch in order to prevent drifting the molars into premature lost second deciduous molars. In this case, you will see how during the transition we also lost one deciduous molar on the lower left, and of course the replacement came on time. When we look at the beginning, in the end of the situation, we see that actually a lot of transition happened, but we didn't intervene anything else than we just stopped the molars on their position to maintain the arch length. Of course, if we are not expecting the second premolars, then we should not use this sort of intervention. With the transpalatal arch, we can also do a lot of different things. So if you just have a look on upper first on the left picture, you will see that those premolars are just coming to its place because we just maintain the space. And mostly there are no other intervention instead of keeping this space available so the teeth can normally come and erupt in their spaces. So this is all what I would like to mention about space maintainers. The next thing should be the habit breaker. See you in the next seminar.